What's up, gurus? Justin Brock here, and today I have another video about how to sell Medicare Advantage. There's two concepts of how, so I wanted to split these up, and I'm gonna go over both. And it's gonna be pretty awesome, so you might wanna go ahead and like the video. Just go ahead and like it, get it out of the way in case you forget, somebody calls, whatever. You know, like the video, comment on the video, tell me where you're watching from, and share it with your friends because this is gonna be some good information. And thank you for liking the video. Now, if you didn't already like the video, then I'm not saying thank you to you. So go ahead and like it so you can feel like you're part of this. You know what I'm saying? So today we're gonna go over how to sell Medicare Advantage. Now, I wanted to go ahead and get the first part of this out of the way because if you find this video, you're likely looking how to get qualified to sell. And that's not really the meat of the video, but I wanted to go ahead and throw that out there in case you're looking for it. Pretty easy. Health insurance license, take a HIP or an alternative test that carriers accept, and then get contracted with carriers, preferably through a marketing organization that gives you access to Sunfire or some sort of other enrollment platform. That's really all there is to being qualified to sell Medicare Advantage, right? However, selling it and being qualified to sell it are two completely different things. So now we're going to get into how to sell Medicare Advantage, okay? So I'm going to read off here. How to convince prospects to utilize you and an MA plan or a Medicare Advantage plan, okay? That's a key point here. How to get them to use you as their agent. Whether they want an MA or not, how to get them to agree to let you help them, okay? And then also how to get them to agree that a Medicare Advantage plan is a good solution for them. Or is it? Sometimes it's not. But once you decide that it is, you need to be able to convince them the same. One, identify your prospect's attitude towards Medicare Advantage, okay? I could get straight into just sales 101 and tell you to build rapport, fact find, all the same stuff that every other sales video in the world tells you. But it's very important to know what the preconceived notions about Medicare Advantage for this prospect are. It's very likely that they have one because there's a lot of controversy amongst senior citizens on Medicare, Medicare supplements, Medigap, Medicare Advantage, and there's a lot of misinformation, which I hate to use that word, misinformation, because it gets overutilized these days, but misinformation about whether a Medicare Advantage plan is good or bad, whether a Medicare supplement is good or bad. The truth is, it's not good or bad. It just depends on somebody's situation and what's best for them. So we want to be able to illustrate that to them after we know what their attitude towards Medicare Advantage is. So number two, I say first, if positive, it sells itself. If somebody already likes Medicare Advantage, then you're likely talking to somebody who has a Medicare Advantage plan, who's used it, and who has enjoyed it. Well, now it just becomes a plan shopping, fiasco where you're just looking to see, is that the best plan for them? Compare other benefits and other options, okay? But if it's negative, then you need to dig a little deeper. Why is it negative? Okay, I've identified that they have a negative attitude towards it, but what does that tell me? Is it because of a misconception? Probably. Is it because of a bad experience they had or a relative had? That can be a little more difficult to overcome, okay? So going further, if they have a Medigap, commend their decision and first attempt to shop rates. Now, this is where a lot of people who are trained to sell Medicare Advantage screw up. They have no Medicare supplements in their arsenal, and they're forced immediately into talking to clients who have a Medicare supplement into buying a Medicare Advantage plan. The persistency on that sale is going to be lower for them because it's somebody who's used to going to any doctor they want to and everything being paid for pretty much. Okay, so even if they have to pay a premium for that, and whether that's the best cost proposition for them or the best benefit and cost situation for them is debatable. However, it's very difficult to take somebody into full-on copay plan. As soon as they start having some bills that are more than they're used to paying, they get buyer's remorse and they try to get out of it. That's very common in that sale. However, it doesn't mean that there isn't a situation where someone would go from Medicare supplement to a Medicare Advantage plan. There certainly are. But if they have a Medicare supplement and maybe their attitude towards Medicare Advantage is indifferent or negative, why not just go ahead and try to shop their Medicare supplement rate? Still very profitable endeavor for you, still a good win for them, still a good win for the insurance company. Win-win-wins is what we're looking for. So let's flip this board over and go on. Flip. All right, so going forward, if not a Medigap prospect, who you're talking to is not a Medigap prospect. Primarily, we're going to talk about if they didn't have a supplement plan and they were negative towards Medicare Advantage. So it's somebody Medicare only or Medicare and Medicaid only. Find out what concerns they have about MAPDs. So I'm going to go over some common concerns, but how do you find out what these concerns are? You can say, oh, I completely understand your reservation with Medicare Advantage. There's a lot of different nuances, and it certainly isn't for everyone. What exactly about Medicare Advantage have you heard that scares you? And get them talking about that stuff, okay? And then you can start to know, well, where do I need to aim, the information that I have to fill the void of information that they currently have. Some common concerns you're going to get are networks, out-of-pocket costs, service denials, and I don't want to lose Medicare or Medicaid. Most common one I think we see is networks. I want to go to any doctor or any hospital I want to anytime. And so one of the easier things to do to hit that head on is to talk about the evolution of Medicare Advantage. You say, Medicare Advantage came on the scene in Medicare, so to speak, over a decade ago. It was certainly not accepted by a lot of doctors, and the way it was presented to people caused a lot of backlash with hospitals and specialists, especially in rural areas. It was really bad in the more rural areas. Over time, however, the companies have taken a different angle. They've come in, they build excellent rapport with hospital systems now, and as long as you get the right company and right plan, and you're checking to see if the doctors and specialists and hospitals that you are currently using or would want to use are in the network, you're probably not going to have an issue with networks. You can also look at a PPO where you have a little bit of flexibility to go in and out of network still, but I wouldn't be as concerned about that. Let's just look up your doctors and see which ones are in and which ones aren't in the network, and that'll kind of give us some idea of how accepted are these plans. Number two, out-of-pocket costs. So out-of-pocket costs, one of the most substantial portions of the out-of-pocket is when someone looks at the maximum out-of-pocket. Okay, if they're looking at the maximum out-of-pocket, a really good statistic to use to combat that is that only 4% of people annually on a Medicare Advantage plan hit their maximum out-of-pocket. So it's relatively low amount of people that hit it, and it's not a deductible. Some people look at that number and they think deductible. I can't afford to pay all that. But when you start breaking down what they pay for each service and how affordable those services can be, and then maybe pair it with a hospital indemnity plan with a cancer rider to offset some of the larger potential out-of-pocket, it can still be a really, really good solution. And that objection can turn into an indicator that they're ready for a cross-sell of a hospital indemnity plan. So I would look at that as an opportunity as much as an objection. Number three, service denials. This is a legitimate concern, because when you get into home health care or some of the other situations where people are getting service or denials for some of these things, like skilled nursing facilities are a big one. That's something that we have seen be an issue with Medicare Advantage. However, there's always the concept that if they hit that point, they can go back to original Medicare if that's what's better for them. But most of the time, we can tell them, hey, those service denials are often happening because billing is not really good yet in those types of facilities at billing to Medicare Advantage. If you look for a skilled nursing facility in an inner city area with a lot of Medicare Advantage plans and a high penetration rate, they're always better at filing towards your Medicare Advantage plans, right? But if you are looking in a rural area, they may not be as good at it yet because they haven't had the practice. So if you help them refile that claim and you're really good with, you have a good agent that will communicate with them and the carrier will communicate with them, normally you can get those claims issues worked out. But if you can't, you can always go back to original Medicare if you need to. Last, I don't want to lose Medicare or Medicaid. So sometimes there's a notion that these plans are replacement, and so you lose Medicare. Now, when you go on a Medicare Advantage plan, of course, you're not on Medicare technically, as Medicare is not the payer of your claims anymore because they have now outsourced it to a private plan. However, you can go back to Medicare, and you're certainly not losing your Medicaid if you are dual eligible by being on that plan. It's just a contract period that can be terminated by various ways, and certainly each calendar year you could go back to a regular Medicare and Medicaid, Medicare or Medicaid. So those concerns are all things that come up often, but they're not really a big concern once you break down the information and how it works. So the objection or the rebuttal to an objection, remember, is always less important than that you have a rebuttal. What most people fail to do is actually have a rebuttal. If I'm listening to 100 sales calls, most people unfortunately get an objection and then just move on to the next lead. That's really unfortunate because leads are not cheap, okay? It's not cheap to get somebody to even talk to you on the phone. So when you have someone talking to you, you have to have a rebuttal. But the rebuttal does not have to be perfect. First, agree with their concern, or at least, feel that concern and understand why they would have it, and then begin to talk to them and give them information that can lessen the burden of what that original objection was, and then you can kind of circumvent right past those objections, because most of them are very, very soft, okay? Now, if it gets into something crazy, like my mama had a Medicare Advantage plan and they killed her, I can see that getting a little bit difficult to get around, but as long as you talk to them and build rapport, you can typically find some way to help them. And it may not always be Medicare Advantage. This is something that Medicare agents that are getting shuffled into the industry right now think it's MA or bust, but it's not. It's MA, it's Medicare supplements, it's hospital indemnity, cancer, standalone, dental, vision, hearing, Part D prescription drug plans. Any way that I can help a client and leave them in a better place, because the next person they refer me to may be a Medicare Advantage plan or a Medicare supplement or something more profitable than the last one. Focus on helping more people, and then you'll build a business that you get plenty and plenty of referrals to. So that's really how you sell Medicare Advantage. It's by not selling it all, but just educating, getting them to like you, building that rapport, and then helping them shop the plans by network and prescription drugs. Most of the time, these plans are zero premium, so it's silly to even call it sales. It's just education, it's talking to them, and it's helping them pick the best plan going forward. Hope you liked the video. Please like the video if you didn't already. Please subscribe to our channel and leave us a comment telling us where you're watching from or any other things you'd like us to cover in the future. Thank you so much. Time to train like a guru. Go Guru University is an ever-expanding, cutting-edge, interactive training platform with live weekly coaching calls constructed to train agents efficiently and compliantly. Go Guru University offers a library of training modules explaining Medicare A to Z, face-to-face and telesales training, SEO and other marketing, and much more. Visit goguru.university to schedule your one-on-one demo today.